Still with coronavirus, we now cross over to the US, where we will be talking to Dr. Kayisinga, who is an assistant lecturer at the Michigan State University at the Julian Samora Research Institute, University Outreach and Engagement. Thank you for making time to be with us, sir.
Thank you for having me.
And good morning to you. Now, Michigan issued lockdown orders. Members of COVID-19 cases surges across the states. How has this been received, and how are you handling this particular since the lockdown is just a few hours back?
It's tough, but it's better. We are staying home so we can stay safe. So we are adapting our lives to protect ourselves. So now we can only work at home. We allow just to go outside to do shopping, and also we encourage to practice social distancing to avoid person-to-person contact. You want to stay at least 6 feet to avoid contamination.
Is it for the Rwandan community, rather, just in Michigan State so far?
They are doing okay. We are connecting via online, make sure everybody's is okay, and exchanging messages, at least how to protect ourselves in terms of following the Center for Disease Control and Prevention guidelines, such as washing hands, which is key to prevent this virus. But we have also students, they are staying inside their dorm and taking courses online.
Brings me to my next question. Of course, most countries are encouraging e-learning as lockdown has been ensured in most parts across the world. How would you say, in your point of view as an assistant lecturer, how is it working there in the US, and how tangible are the results if students learn through e-learning? At
MSU, the university closed off face-to-face instruction. That includes lectures, seminars in classrooms. So all the students are taking their courses online. So we have an online platform where faculties can post their lectures and communicate with students while at distance, assign them activities, but also assess them and also give them readings. So courses are continuing even though students are taking them virtually.
As a sociologist, I know that you're a sociologist. What would you deem the behaviors of the young generation that's, still insisting, going out, especially when we have the calls of social distancing? As a sociologist, how does this affect the world generally?
That's a good question. It is true that young people have a lower risk of dying from COVID-19 as compared to, let's say, older adults and those with chronic conditions such as cardiovascular disease or diabetes. But yet, they are not invisible. They can contract the virus and then spread the virus to their loved ones, including their parents, their grandparents, who are most vulnerable and can die from that disease. My message to young people is also to follow others and practice social distancing to avoid the risk of getting the virus and also infecting others. This is not a joke. They have to say this virus is very, very dangerous and they have to take it seriously. So that means they have to avoid kissing, handshaking, embracing, staying together in crowds, because they can, even though they can survive, but they can also infect their loved ones.
Pandemics, do you also think that these behaviors that we have, kissing, handshaking, and hugging, do you think this will eventually change in our minds, that we will eventually stop, and continue the fist bumps or the elbow bumps that we are doing right now?
Right now we have to, because this virus, you contract it through person to person, through our mouth and nose, So you have to keep distance in order to avoid contracting it. Then later on, once it's gone, then people can still, embrace and shake hands. So, but at this point, I think you have to encourage everybody to practice really social distance to avoid contracting the virus.
But before I let you go, the emphasis of research, because I also know that you're a researcher, why is it important that we now put more efforts in research, in regards to corona? Because I believe if the research was there, maybe the medicine would have been there, because we've seen, publications saying that this virus was mentioned before, but it is killing us right now.
Research is it's very critical at this moment, and when people have to rely really on real research, because many people are trying to find the drugs, and I've heard news about chloroquine, but there is no research that shows that it can cure that disease. So, because every drug has to go through clinical trial, which will take at least, with 3 phases, it will take at least 1 year to really have it, to make sure the drug will help people about this coronavirus. So research is critical at this moment, because everybody wants to get something that would prevent COVID-19. So we need to rely on experts and what they say about how to treat it, how to prevent it. Hopefully we later on have also a drug to deal with it.
Thank you very much, Dr. Kayisinga. Dr. Kayisinga, of course, is a sociologist by profession, but also an assistant lecturer at Michigan State University, and was giving us some of the tips, especially being a sociologist, on why we need to social distance and especially listen to the authorities.